The basic forms of communication that we used with the case we are going to present today was a 3M oral care portal. The oral care portal is part of a digital workflow. While many orthodontists are probably familiar with some sort of digital workflow when doing aligner therapy, you general dentists may not have ever utilized a digital workflow. The oral care portal is really just a cloud-based software program accessible on your computer, which provides access to digital treatment design and facilitates communications with 3M and your orthodontist.
The 3M Oral Care Portal offers me several ways to evaluate my treatment design, including the tooth movements, evaluating the mechanics I have planned, checking my anchorage requirements. All is visible from every angle as I rotate the model. There's a grid in the portal used for measuring changes from the malocclusion, and a movements table feature is really valuable for confirming changes in the tip and the torque in all three dimensions. If I had a vertically sensitive case, for instance, I can check the movements table to confirm that no extrusion has been applied to the posterior occlusion. Sometimes these small movements are harder to visualize, and having the numbers supports my decisions. Once I do have a plan established, I can report my findings to Lois or to other members of the treating team by simply exporting the setup, or I can delegate that to a team member to do later. At the conclusion of this collaboration and communication, we have a treatment plan that has the approval of the entire team. The patient is well informed with accurate expectations. With aligner therapy, the 3M Oral Care Portal offers a valuable progress evaluation. In addition to the clinical checklist of checking aligner fit, floss contacts, measuring spaces, marking occlusal contacts, the progress scan provides a more concrete, I think, evidence-based understanding of the progress and the treatment design tracking. You can review the progress with an overlay from the malocclusion to the current stage. You can use the movements table again to quickly draw your eye to what's not tracking with the treatment design. Sometimes a side-to-side view can help you see the changes more clearly. And while I'm right there in the portal, I can export a video to Lois so she can see the progress to date. It reminds her that we have a case together and assures her that progress is being made. We can confirm from the before and after photos that the orthodontic goals have been achieved. I often tell the patient that the orthodontic treatment won't make your teeth look pretty. We set the foundation up for the restorative dentist to do that. And now Lois can show you just how that's done.
While I certainly could recontour the teeth by hand with specialized matrices, that can be very hard and time consuming. We both agreed that this was a perfect case to use composite and the Filtech matrix. So what is a Filtech matrix? It is a customized matrix that is 3D printed and is part of a digital workflow, which enables us to create aesthetic anterior composite restorations faster, more conservatively, and extremely predictably. You can see that the full matrix has two pieces, a lingual and a labial piece, that fit together and form a template for the new smile design. You can see the steps involved, including putting our records into the portal and creating a restorative design. 3M then does their part by designing the matrix, 3D printing it, and adding a post-processing coating that prevents the composite from sticking. The matrix is then shipped off to the dentist. In this case, the laterals look disproportionately wide compared to the other anterior teeth. By using the Filtech matrix and placing composite veneers on the 6 anterior teeth, we can even those contours out and make a more ideal smile.